Hi everyone, welcome back to Hygiene and You. Some time ago I had done a video on using menstrual cups with IUD, and once I posted that I received a lot of questions on copper T or IUD itself. So I decided that we'll discuss this in detail with Dr. Kiran Kukreja.
Hello viewers.
Recently, we also did one video with her on various birth control methods, and I'll post a link to that here if you want to see, where we had covered different kinds of birth control methods. And today we will do a focused video on copper T or IUD. So, doctor, can you tell us what is a copper T and what does it look like?
Copper T is a very small plastic device with a fine copper wire wrapped on the vertical limb, and we insert it in the uterine cavity like this, and the thread remains in the vagina about 2 to 3 centimeters. The copper has an action of reducing the motility of the sperms and also prevents implantation of the fertilized ovum.
And why do we use copper T?
It's to prevent birth, to prevent conception, to do spacing between two children.
Is it safe to use or does it have any side effects?
It's very safe and convenient method for contraception, because once you get this inserted, you have no other worries. You cannot conceive while this is of course there's a very little failure rate with copper T. We have seen in 1% cases pregnancy can occur.
Okay, and are there any side effects with this?
uh, Besides little excessive bleeding during periods and maybe pain during the first 2-3 cycles, there are no other much side effects. These can be taken care of if you're taking some painkiller tablets.
So in first 2-3 months of installing the copper T, it's normal to feel it or have some pain and bleeding during menstruation.
It takes that much time to adjust in the uterine cavity. After that, you don't even feel it is there.
Are there any conditions like a UTI problem or any other condition where one should not go for copper T?
Actually, if there is any infection, like in the pelvis, say in the uterine cavity, in the vagina, even urinary tract infection, they should be treated first before getting an IUCD done.
And what if someone is very prone to UTIs? You know, some people get it each month or every few weeks.
Well, the urinary tract is entirely a separate passage than vagina, so there is no direct relation. But still, urinary tract infection has to be treated alongside, and copper T can be inserted.
And are there any other names for copper T?
It's mainly called copper T. It's intrauterine contraceptive device, and multi-load is another IUD available. Some people prefer that, though they have the same action. There is no difference. Only the shape is the one I said is this is a T-shaped, and the other one is an inverted U-shaped.
Okay, so the only difference is in their shapes, but they work in a similar manner?
Well, there's a little difference also in the insertion, which the doctor, of course, has to take care of.
Is the insertion of a copper T painful?
Not at all. It just takes 2 minutes, and it's an OPD procedure. But it is always done right after your menstrual period, so that pregnancy is ruled out.
Once it's inserted, can we feel it?
Of course, if you insert your 2 fingers in the vagina, you can feel the thread, but we don't recommend that because we don't want to get any infection inside the vagina. So it's better to go to the doctor for a checkup after 1 month and then maybe annually.
And in our day-to-day routine, after inserting the copper T and once the body has become used to it, will we still feel it that
Not
it's
at
there
all.
in the body?
It's a device which is inside the uterus. The thread is just a little bit in the upper vagina, and you don't feel it at all. But only in the beginning, like I said, if you have heavy bleeding or painful periods, maybe first 2-3 months, it will take time to adjust in the uterus. You can take tablet to reduce bleeding and to control pain.
And should we check the placement of a copper T by ourselves at home?
We don't recommend that because we don't want to introduce any infection in the vagina. If you're doing it yourself at home, maybe your hands are not clean, and if you're doing it very frequently, you can introduce infection in the vagina, which we don't like to have.
And how often should we get the placement of the copper T checked by a doctor?
First time when it is inserted, the next period is over, you go for one checkup, and then every year it's better to get it checked, because we'll also see it's in place. If there is any other infection associated, we can get treated as well.
And once the copper T is inserted, are there any circumstances when we need to visit a doctor?
If you are having too much bleeding during periods, which is not controlled even with tablets, and if this lasts for more than three months, it's better to go to the doctor. Maybe it doesn't suit you if you're having too much pain, and some other method of contraception can be then taken.
So if basically we are feeling a lot of pain or a lot of bleeding for 3 to 4 months,
Yeah.
then we should consult a doctor.
Even right after insertion, if there is too much problem, bleeding or pain, please go back again to get it checked. Maybe it has been not placed properly.
Does it affect sexual intercourse?
Not at all. Just we leave 2 to 3 centimeter of thread in the vagina. It does not interfere at all with intercourse. I don't think you need to worry about that. Only if the thread is felt by the partner, please go. Maybe the thread is a little longer, or maybe it's roughly cut at the edge. Then you please consult your doctor.
So in ideal conditions, it won't make any difference during intercourse?
Ideally, you should not even feel the copper T or the thread.
Can you tell us if we can use a menstrual cup along with copper T?
Yes, the menstrual cup can be used very safely because the cup will be in the lower part of the vagina only. Like I showed the copper T is here, the thread is here, and the menstrual cup is right here at the lower end of the vagina. So even while taking out the cup, please release the vacuum gradually and remove the cup. It will not interfere at all with the copper T. Even if it is touching the thread, cannot dislodge the copper T at all.
All right, doctor, thank you so much. This was very helpful, and I hope we have covered all the viewers' questions. And thank you so much for coming on the channel.
Thank you so much.